Mesothelioma is a terminal disease, so it's no surprise that a diagnosis feels like a death sentence. You hear aggressive cancer and limited treatment options and start thinking that your life is immediately over. But what doctors sometimes fail to communicate clearly is that you can still live well with mesothelioma. Not just survive, but actually live. Maintain your quality of life, pursue activities that matter to you, create meaningful memories with family, and find moments of joy even while fighting this disease. Today, I want to talk about what living well with mesothelioma actually looks like. I'm Terry Oppenheimer, and I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. And I've learned from countless patients and families that life doesn't end with diagnosis. Let's start with an important reality check. Living well with mesothelioma doesn't mean pretending that the disease doesn't exist or that everything is fine. It means acknowledging the reality of your situation while choosing to focus on quality of life, maintaining hope, and making the most of whatever time you have. The first step to living well is definitely getting the best possible medical care. Getting the right treatment can significantly improve both the quality and quantity of your life. Modern treatments like immunotherapy, targeted chemotherapy combinations, and surgery for certain patients can control disease, reduce symptoms, and extend survival. But medical treatment is just the foundation. Living well requires managing symptoms effectively so you can engage with life. The most common symptoms, shortness of breath, pain, and fatigue, they can all be managed with appropriate interventions. For shortness of breath, treatment might include draining pleural effusions to relieve lung compression, oxygen therapy to maintain oxygen levels, breathing exercises and techniques to improve breathing efficiency, medications to ease breathing, and positioning strategies that make breathing easier. Many patients find that managing shortness of breath allows them to continue the activities they enjoy, even if they need to modify them. Maybe you can't hike mountains anymore, but you can take walks in the park. Maybe you need to rest more frequently, but you can still garden or work on projects. Pain management is crucial. Mesothelioma can cause significant pain, but modern pain management approaches can usually control it effectively. This might involve a combination of medications from over-the-counter pain relievers to prescription opioids for severe pain, nerve blocks for specific pain patterns, radiation therapy to shrink tumors that are causing pain, and complementary approaches like acupuncture or massage. Whatever you do, don't suffer in silence. If you're in pain, tell your medical team. There is no virtue in enduring unnecessary pain, and uncontrolled pain prevents you from living well. Now, I want to take a little break here for a second and ask you a favor. If you're finding the information in this video helpful, please hit the like and subscribe buttons. It really helps us get seen by more people. And if you have questions you'd like answered or a topic you'd like covered in a future video, send me a note in the comments section. And make sure you watch this video until the end, because I'm going to give you information about accessing help and resources. Fatigue is probably the most challenging symptom that mesothelioma patients face because it affects everything. Cancer-related fatigue is not just feeling tired, it's profound exhaustion that doesn't improve with rest. Managing it requires energy conservation strategies, prioritizing what matters most and letting go of less important activities. It also means accepting help from others, planning activities for when you have the most energy, gentle exercise, which counterintuitively can actually improve your energy levels, and treating underlying causes like anemia or depression. Nutrition matters for maintaining strength and quality of life. Cancer and cancer treatments can affect appetite and digestion. Working with a nutritionist who understands cancer can help you maintain adequate nutrition, even when eating is hard. Small, frequent, nutrient-dense meals often work better than trying to eat 3 large meals a day. Try to stay as physically active as your condition allows. This may sound crazy or even impossible, but when you're fighting cancer and dealing with fatigue, research has shown that appropriate physical activity actually improves quality of life, reduces fatigue, maintains strength and function, and may even improve outcomes. Obviously, you do need to adapt the activity to your abilities. If you were a runner before you were diagnosed, maybe now you walk. If you were sedentary, maybe now you do gentle chair exercises or take short walks. The point is to move your body in ways that are safe and appropriate for your current condition. Mental health is just as important as physical health. Depression and anxiety are common after cancer diagnosis. They are not signs of weakness. They're normal responses to a traumatic situation, but they need to be addressed because they significantly impact quality of life. Treatment for this might include counseling or therapy. Many cancer centers have social workers or counselors who specialize in helping cancer patients. There are support groups where you can connect with others facing similar challenges, and there's medication for depression or anxiety if you need it. There are also mind-body practices like meditation, mindfulness, or gentle yoga. Maintaining social connection is vital. Cancer, it's isolating. You might feel different from healthy people or worried about being a burden or just too tired for social activities. But isolation makes everything worse. Stay connected to your family and friends. Accept invitations even if you need to leave early or modify your plans. Let people help you. It gives them a way to express their love and support. Focus on what you can control rather than what you can't. You can't control whether you have mesothelioma, but you can control how you respond to it, what treatments you pursue, how you spend your time and energy, what relationships you prioritize, and what gives your life meaning. Many patients find that mesothelioma, as terrible as it is, clarifies what really matters. Trivial annoyances that once seemed important fade away. Relationships deepen. Patients often describe becoming more present, more grateful for small pleasures, more aware of what's truly important. Set goals and work toward them. These might be big goals, traveling to a place you've always wanted to see, reconnecting with an estranged family member, completing a meaningful project, or it could be small daily goals like taking a walk, cooking a favorite meal, calling a friend. Having things to look forward to and work toward gives structure and purpose to your days. Create meaningful memories with the people you love. This might mean planning special trips or experiences as long as you're able to, recording videos or writing letters for family members to have in the future, organizing and labeling photos so your stories aren't lost, or simply spending quality time together doing ordinary things. Be realistic about your prognosis, but don't let statistics define your experience. Statistics, they tell you what happened to other patients in the past. They don't determine what will happen to you. Some patients far exceed their prognosis, so focus on living today rather than worrying about statistics. Maintain a sense of humor whenever it's possible. This doesn't mean making light of a serious situation or pretending that everything is fine, but finding moments of laughter, appreciating absurdity, and not taking everything so seriously can provide relief from the intensity of dealing with cancer. Consider what gives your life meaning and purpose. For some people, that's their faith or spirituality. For others, it's family or creative expression or helping others or leaving a legacy. Connecting with your sense of purpose can provide strength and resilience. Practical matters also affect quality of life. Financial stress, legal concerns, and logistical challenges managing medical appointments, they can all add to the burden of illness. Address these issues proactively. Get your legal and financial affairs in order so you're not constantly worried about them. Pursue legal compensation if you're eligible. That money can reduce financial stress, allow you to access better care, and may even allow you to fulfill some lifelong dreams. Accept practical help from others, meaning transportation, meals, housekeeping, and other tasks. Living well with mesothelioma looks different for everyone. For some, it means fighting aggressively with every available treatment. For others, it means choosing quality over quantity and declining treatments with severe side effects. Neither approach is right or wrong. The right choice is whatever aligns with your values and goals. So, can you still live well with mesothelioma? Yeah. Living well means getting effective medical care, managing symptoms, staying as active as possible, addressing mental health, maintaining social connections, focusing on what you can control, creating meaningful memories, and connecting with what gives your life purpose. A mesothelioma diagnosis changes your life, but it doesn't have to end your ability to experience joy, connection, and meaning. Visit mesothelioma.net today to get onto resources about living with mesothelioma or to speak to one of our helpful patient advocates. You can call us at 1-800-692-8608 or use the live chat feature on the website to speak to somebody directly. As for me, post any questions you have below, and I'll see you next time.